Hi, this is Dr. Inkyong Parrack. Welcome back to Whiteboard Wednesdays. Today, we're going to talk about vascular screening, when and how often. So I get asked a lot of questions about, do I need vascular surgery? Do I need vascular screening? Short answer is yes. More and more, as you know, whether it be due to our diet, what's in the water, or whatever may be in the medications, we're seeing that there's unusual number of disease processes such as plaque buildup, cancer, that are now seen in younger and younger population. And not only that, there's a lot more kind of varieties of with it. And in vascular surgery, what we're seeing is that even in younger population, and especially in the older population, a lot of the plaque and some of the disease processes have a lot of tougher materials such as calcium buildup that makes operation and treatment difficult. What it means is that at some point you do need to figure out whether you have any of these vascular conditions that need something to be done in order to prevent or be treated so that you can get fixed. The first question is when. I think when is when you think about it. At some point in your life, in your 20s and your 30s, you're not going to think about this. You're in healthy shape, you're running around, you're going to be doing everything that you want to do. However, when you talk about vascular surgery disease and how it has become more and more prominent in terms of plaque buildup, at some point in your life, you're going to think about it because one, you're either getting older and you see, my friends, my family members are having this, maybe someday I should think about it. Or second, even when you're young, you might think about it because, well, all of my grandparents and parents, have some of these issues. My uncles are having issues with stroke and heart attack, and maybe I should look into this. So when that thought comes into your head, you're either getting a little older or you have some risk factors that you're worried about. The three simple things that we check in vascular surgery that spot checks is the carotid arteries, and that is, it's going to be a gradient or a number. It's either going to say you have zero disease, which means, hey, you're doing well and just keep up the good work. Or it's going to be you have some thickening, which means you are not at risk of stroke right now. However, thickening of the carotid arteries have been associated with cardiovascular disease down the line, meaning you are at a higher risk of having a heart attack down the line. So we do need to keep an eye on you, and maybe we do need to start changing some of the exercise and diet patterns to get you into the right track. Or third, you may have a real number, whether it be 10% or 40% or 60%. If there is some real number attached to it and not just the thickening, that means you have to sit down with the vascular surgeon and they are going to follow you over time. So then you're now from a screening stage, and then now you're going to be plugged into a follow-up pool. Let's say I've done my vascular screening, which I've done myself, and everything came out perfect. There was no issues and everything was good. And let's say that was in your 20s. Well, sometime in your late 40s, you should get it checked again. Late 40s to mid 50s. If that happens at that time, you may still have 100% perfect, meaning there's zero disease, in which case you don't really have to look at it again. Versus if there is some disease that are starting to develop in the late 40s to 50s, then now you're going to be at a point where you're going to be a carotid artery follow-up rather than just screening once. And if you have, significant disease, then obviously you have to sit down with a vascular surgeon and figure out what the next steps are. So in terms of the aneurysm in the abdominal arteries, it's actually very different. So if you have family history of aneurysmal disease, we suggest that you get checked in your mid to late 40s. If at that time not significant disease is found, then I tell people to get it checked again in the mid to late 50s. And if there's no disease found at that age, no aneurysms, nothing like that, then you don't have to worry about it ever again. And then you're done with that part of the screening. However, if you happen to find an aneurysmal degeneration, then you're automatically off of the screening, and then you're plugged into the follow-up side of the patient. So then you have to see your vascular surgeon. A lot of times when it's smaller at 3 something size, then what we're probably going to do is do an ultrasound once a year. As it starts to get bigger, then we're going to move on to a CT scan and start talking about it. And as you saw in some of the aneurysm lecture series, we start to talk about really sitting down and fixing it at size 5.0 centimeters for women and 5.5 for men. Although if the shape is is irregular or saccular, then we talk about fixing it at a much earlier stage. Let's talk about the legs. So the legs are interesting because legs are one part of the vascular surgery where you don't really need to get things pre-fixed and prevented. Meaning if you start to have some plaque disease, you are either going to have symptoms or you have no symptoms, in which case no surgery is needed. However, sort of in the middle ground are those that have vascular surgical issues such as plaque disease, and they have zero symptoms, but it is significant enough that we need to worry about medically doing something about it. So that means we start talking about being a lot more aggressive with holistic care, changing up your exercise plan, changing up your diet. I generally say to my patients that reversing atherosclerotic or plaque disease is almost impossible, but I've definitely seen it, and I've been very inspired by some of my patients who have taken this to a new level and have come up with extremely strict diet patterns, and a lot of them have been associated with some sort of vegan diet. It's a very specific form where they do the vegan diet with homemade foods instead of just taking something that's pre-made and then just heating it up, and cutting out a lot of salts. And people have been able to really make huge changes to their overall health and vascular health by doing something like that. So that would be what preventative medicine can do for you when you screen, and then you never have to worry about having gangrene or leg pain or any of these issues that can arise from initial atherosclerotic disease that may have gone unnoticed. So the three parts that we screen, the carotid artery, the aneurysm in your abdominal aorta, and lower extremity disease with the ABI, the ankle brachial index, can all provide you with various different informations, and their staging in terms of when you need to get screened and how often needs to be followed up varies. So please go get your screening today. Let's keep you healthy. This was Dr. Inkyong Parrack, and see you next time on Whiteboard Wednesday. Thank you.